Happy Sunday! We are talking thyroid health today. I'm Dr. Jordan Leasure. I'm the owner and physician of North Shore Proactive Health, a state-of-the-art wellness clinic in the northern Chicago suburbs. And this is our stress management boot camp. We are discussing all things stress, how it impacts our health, and what we can do to support it, not only during this very stressful time, but in the coming weeks, months, and years. So let's get started. We have a lot to talk about today. We're discussing thyroid, what it is, what affects thyroid health, how stress impacts our thyroid, and what you can do about it. So obviously the thyroid is very complex. This could make up multiple videos. There are over 20 million Americans that are currently suffering with a thyroid issue, and that could be thyroiditis, which is inflammation of the thyroid. It could be hypothyroidism, where your thyroid is not producing the hormones in the amounts that it should be, and that is most routinely seen or caused by having an autoimmune condition. And again, that autoimmune condition most regularly is Hashimoto's thyroiditis, which some people I'm sure can relate to. And then finally, we'll talk a little bit about hyperthyroidism, where your thyroid is producing too many hormones. There's too much going on with the thyroid. So to hop right in, some factors that inhibit the production of thyroid hormones. And this is a lot of what we've talked about before. If there's one thing that you get from any of these videos, I hope it's that dysfunction in the body doesn't happen in a bubble. So if you're going to see a specialist right now because you have a cardiac issue, there's something going on with your heart, please make sure that everyone else is examining the rest of your body, because every system, every organ is connected to every. This should be common sense, but I think that we forget. Every system, every organ in the body is connected to one another. It communicates with one another. I guarantee if you have inflammation in one area of your body, you have inflammation somewhere else, even if you're not symptomatic. So that's some of the benefit of working with a functional medicine physician who is looking at you as an entire system, as opposed to just pinpointing specifically on one organ and everything else gets ignored. So, factors that inhibit the production of thyroid hormones. The number one thing on my list is stress. So if you can relate to that, give me a thumbs up. If you're experiencing stress, if you're handling your stress really well right now, give yourself a thumbs up for that. Infection, trauma, radiation, or medications. And again, we've discussed this before. Even if you're on a medication and it is benefiting your thyroid, or it is, or excuse me, if it's benefiting a different organ or condition that you have, it may be damaging to the thyroid. Fluoride and bromide. So please, one thing that you can do is get your water tested at your home and see if you have excessive thyroid or other halogens in your water. You may want to get a specific water filter. And everybody is different. It depends on where you live. It depends on a lot of different things, but get that water tested. Toxins, of course, pesticides. So we all know, we talked about the quality of our food, mercury and lead. If you are routinely getting vaccinations, depending on your job, if that's a requirement, if you are military and you've had a lot of vaccinations, there's a lot of different chemicals in those, and those can impact your thyroid as well. Obviously, having an autoimmune condition. If you have one autoimmune condition, your likelihood of having up to 3 increases huge. So take a look at your thyroid, even if you again are not currently symptomatic. Hello, Jan, checking in live. And everybody say hello, where you're from, if you're watching live, if you're watching the replay. If you have questions as I go through this, please let me know. Even if it's after the fact and you're watching a replay, I go back through and review, so we can discuss those at a later date. If you have a private question that you'd like to ask, feel free to PM me as well. Nutritional deficiencies and oxidative stress are also very taxing on the hormone. They will decrease your production of thyroid hormones. Now, why is this important? Because if you go to a physician and they are testing your hormones, which we'll get into what they should be testing, and you come back with low thyroid hormones, Now, is the answer to automatically put you on a medication, or should the answer be to review that list that I just went over and see if there's anything in there that you can modify to take that stress off of the thyroid so that your body's working as well as it can be? That's what we're trying to get across right here. Some factors that can increase the production as well. That's a similar list: stress, inflammation, toxins, liver or kidney dysfunction, and infections, of course. So some of what I hope you get out of this is the immediate action that you can take to manage the stress that you're currently under, so we're not doing any additional damage to our thyroid, but also in the future when things calm down and you can get back to a somewhat normal, whatever that may be, life, maybe you call up your endocrinologist and you ask for some of these tests to be done, or maybe you look internally and you spend this time that you have right now cleaning up some of these lifestyle factors, so then in 6 months when you go to get your thyroid tested, you rock that test because you've made so many new changes and everything is functioning the way that it should, because that's what the body needs. You just need to remove the interference and it'll do its job, believe me. Some factors that can increase production of thyroid hormones are key nutrients. So again, eating well, eating what we should be, iron, iodine, tyrosine, zinc, selenium, our vitamins, our B complex, our C, our D, all of those things. Factors that will help to increase the conversion of T4 to T3, which is what we're looking for: selenium, and if you're not familiar with that, great mineral, zinc as well, terrific these days to help boost our immune system, vitamin A and vitamin E. And those sometimes don't get the attention or the due diligence that they deserve, but don't forget those vitamins as well. And then factors that will help improve the sensitivity that your cells have to the thyroid hormone, which is also important as we go down that chain of how the thyroid impacts your health. Vitamin A again, zinc, and exercise. So I have some friends, and I'm not going to call them out on here, but they know who they are, that only exercise, or say they only exercise so that they can eat certain things, or let's say that they don't exercise because they think that they eat well, they're happy maintaining a certain weight and they don't feel that they need for exercise. And I will remind you once again that your genes don't know what century it is and that we sit around all day and that that's okay. Your genes have the expectation of exercise and movement, and that movement is not simply walking from your bed to your car, from your car to your desk, and from your desk to the kitchen table or to the couch. Your body has the expectation of routine movement. Again, think of yourself as an African on the plain and you're running away from the lion, or you have to run and actually hunt and get your food. You can't just drive through the drive-through or run to the local store and pick it off a shelf. You actually have to do some activity. That's what your body craves, and it will function so much better if that's what you give to it. So try that and let's see how that works. I want to talk a little bit about thyroiditis because I don't think that gets addressed very often. So that is an inflammatory condition, and you may or may not be symptomatic, but I can tell you that subclinical thyroiditis, and I just lost my notes, subclinical thyroiditis leads to clinical thyroiditis. So if you don't take a look at it, it's just going to get worse. Avoiding some of those inflammatory foods, like we've discussed before, milk, grains, those things that are going to increase phlegm. Those, if you can avoid those, it's going to be very beneficial for how your thyroid is working. Drinking clean water and green tea is fantastic. Again, green tea can have a lot of caffeine, so watch, what time you are consuming your tea. I'm sticking with water and all of my powder vitamins today. Stress reduction is huge for thyroid function. And again, a lot of us, we can't change the stress that we're exposed to, but we can absolutely change how we respond to it. So let's get some of those breathing exercises into your daily routine, practicing meditation, practicing your gratitude journal. All of that will help your thyroid to function better. And men are a very small subset of those individuals that have thyroid dysfunction, but it shouldn't be ignored. And if you are, or you know a male who is having thyroid issues, you should absolutely have your testosterone checked, because your adrenals, your thyroid, and your sex hormones all function together. So if, again, no matter what sex you are, male or female, if you're in the middle and you're experiencing thyroid issues, the first thing your doctor should do is test your adrenals, because I guarantee your adrenals are not working as well as they should be. You should also take a look at your sex hormones. And vice versa. Let's say that you're a female and you are struggling with infertility. Your physician needs to run a full thyroid panel. They also need to run an adrenal panel on you, because if you improve how that thyroid is working, your fertility is going to go up. So that may, and again, watch this with this quarantine, watch what's happening, because N-acetylcysteine thins mucus. And all these healthy habits, we might be increasing conception levels as we're going here. If you are experiencing thyroiditis, you can use castor oil packs right on the thyroid, and that actually is beneficial as well. A few vitamins that can help, and again, please discuss with your physician before you start or stop or consider cutting back on any prescription medications or adding in any supplements, so that you are well aware of how these will not only impact your physiology, but also the effectiveness of any medications that you're taking. Selenium, again, that can improve your thyroid function by decreasing antibody levels up to 40%. So if you're experiencing Hashimoto's, if you have hypothyroidism, there's a high chance that you actually have Hashimoto's, which is, again, an autoimmune condition. But taking selenium can improve that antibody level up to 40%, which is huge. So can cutting out gluten. That's the number one thing that will benefit Hashimoto's thyroiditis, is going gluten-free. Because what that actually is it's your body attacking the thyroid. And your body doesn't know a gluten molecule, this is a very simplified explanation, but a gluten molecule and a thyroid cell look exactly the same to your body. So if your body is, fighting the thyroid and it sees all these gluten molecules, it increases the fight. So it's going to, fight this gluten, but it's also going to send more fighters to your thyroid. So that's why if you can eliminate gluten, you're going to decrease the attack on the thyroid, and you're going to improve your thyroid functioning. So that's a little bit about thyroiditis. Hypothyroid. So some additional foods that can interfere with thyroid function if you are hypothyroid is soy. So really watch your soy consumption. Again, in the United States, the majority of our soy is GMO, so that's part of the problem. Soy actually blocks iodine, and we need iodine for proper thyroid functioning. Look at how many uncooked cruciferous vegetables you're consuming. This is sort of an area of argument amongst functional medicine physicians. Some people will say stay away from your cruciferous vegetables if they're uncooked, like broccoli, cabbage, cauliflower. Some say you have to consume so many that it's irrelevant if you're doing it. So I kind of fall in the middle, and I just say be careful. I don't think there's anybody that's really consuming that much raw broccoli that you're going to have an impact, but you never know. I don't know what's going on in your kitchen, so just be aware of it. Try to eliminate some of these toxins we're exposed to. So by getting rid of those toxins, we talked about cleansing the other day, doing a detox. If you have an infrared sauna, I'm so jealous. I have a couple friends that have infrared saunas at their house. Hi, Michelle. Thanks for watching. Question is not directly related to thyroid. I don't know if I can click on this on my phone. Yeah, it's not letting me open it up. So Michelle, we'll talk about it later. We'll chat. Oh, I got it. Is there an optimum order to be taking vitamins morning or evening with food, empty stomach? Okay, so this is a really good question, especially as it pertains to thyroid. You don't want to take any vitamins or any other medications at the same time you're taking your thyroid medication. So that may really screw up your day as far as planning and scheduling. Generally speaking, you always want to take your probiotics with food, ideally with raw fruits or vegetables. So again, that morning or evening is irrelevant as long as you can consistently remember. And the same with vitamins. The majority of your vitamins can be taken, at any time. You want to watch their purpose. B vitamins can often be energizing. There's other supplements that can be energizing. Obviously, you don't want to be taking those before bed. So if you can space out, if you're doing your thyroid medication in the morning, first thing, 30 minutes before you eat or whatever the recommendation is, and then you're doing your breakfast. Then you can do your vitamins after that if it's been, about an hour since you've had your thyroid medication. So that actually is relatable. It's a very good question. For me, I take a lot of vitamins, so I try to change up the way that I take them. So this is such a pretty color because it has powdered vitamins, it has my collagen powder in it, it also has my powdered inositol for mood, which I'm doing twice a day these days. And then I'll do my handful. I'm doing my vitamin C every hour. Today I'm doing 1,000 milligrams every hour to bowel tolerance. And just to let you know, it's been about 4 hours and I'm still hanging in there. You can do, I take that, I take my NAC, I take my zinc. Take your zinc with food, otherwise that will give you an upset stomach. Generally speaking, minerals with food, vitamins without. But again, my rule is if you'll remember, it doesn't matter. That's a generic. Back to some thyroid recommendations. And again, you should see a common theme here. There are some very healthy habits that are gonna improve the functioning of the majority of your organs. That's what you should stick with. That should be ideally your new normal, but you do what works for you. I can give you a list of things you should do that are gonna give you an ideal lifestyle, and you're gonna say, that's not for me, or I'm not willing to do that, or I'm not to the point where I feel that I need to. And that's okay. You pick and choose. You do what works for you and for the quality of life that you're looking to lead. Some more nutrients that can support normal thyroid health. Seaweed, is good if you're up for that. I'm a big fan of seaweed. I can't do it at home, but I would love to. Ashwagandha can work either way. Again, this is a very, very powerful herb. It's great for mood, like we discussed, but you want to take a look and see if it's right for you. It can both improve thyroid function and decrease thyroid function. Like a lot of herbs do, they can work either way depending on your physiology. Zinc, again, is fantastic. Vitamin D is essential. Some symptoms to look for when it comes to low functioning thyroid. And again, a lot of these are very familiar. Women can pretty much name this list on their own. It's weight gain, fatigue, cold intolerance, constipation, slower heart rate, hair loss. A lot of these things are also experienced after giving birth. So postpartum thyroiditis is very common. A lot of it will resolve on its own. Again, notice I use the word common and not normal. The problem and the reason that it is so common is because the majority of women are not setting themselves up, are not giving themselves enough proper nutrition when they're thinking about becoming pregnant, when they do become pregnant, and then after giving birth. And then breastfeeding is even harder on the body than being pregnant. So ladies, if you fall anywhere in there, or if you know anyone that does, nutrition really, really is super important during conception, during pregnancy, and then after. So keep that nutrition high. Make sure you're doing a very high quality prenatal, which is very hard to find, and really taking care of yourself during that time. Stress management is super key too. Let's fast forward to some thyroid tests, because this is an area that really chaps my you-know-what, because I don't think the majority of doctors are testing patients to the extent that they should be. So if you've had a thyroid test and your doctor says you're fine, I would suggest that you bring this list in to either your endocrinologist or your primary care physician. If you are currently taking thyroid medications and your physician either says you're fine or says you're not and they want to keep increasing your medication, I would suggest that you take this list to them and that they run this full panel and they examine the full picture of what's going on. Again, the majority of women are only having one thyroid test done. It's similar to taking a picture of someone's eye. You can't tell the sex of the individual. You can't tell the race of the individual. You can't tell if they're happy, if they're sad, their height. You can't tell a lot if you're just taking a picture of the eye. And that happens very often these days with thyroid testing. So I would ask that they run a full panel. Now, does everyone have their pen and paper? I'm going to tell you what a full panel looks like. It's your TSH. It's your T4, your T3, your reverse T3, your free T4, your free T3, and your antibodies. I think I wanted to make sure I got them all. And then when they're looking at dosing, you want to, again, take a look at TSH, T4, and free T3. So make sure they run that full panel and then that updated panel every time they're looking at modifying a dosage. Because things can change over time. Your body can be working more effectively, more efficiently, and vice versa, depending, again, on your lifestyle. So let's make sure you're doing all of that. Some other things that I recommend from a functional standpoint for all of my thyroid patients or possible thyroid patients is taking a look at your iron levels. Running an iron profile is very important because your thyroid is going to be impacted by iron. Also running a vitamin panel, because if you are nutrient deficient, the thyroid is, like we discussed, your thyroid's not going to be working as well as it can. So if we can get your nutrition up, if we can get your utilization of vitamins up, if we can heal the gut so everything's working more efficiently, then maybe you won't need thyroid medication. The thyroid will heal itself and function the way that it should. So finally, let's talk about what hyperthyroidism is. And that is not as common. That means that there is more going on. The thyroid is pumping out too many hormones. And some signs and symptoms of that are obviously the reverse of hypothyroidism. So you're up, you are possibly having diarrhea. Again, there can be some sleep issues with this as well. Avoid all grains if you are having hyperthyroidism. Food sensitivities are very, very common. So make sure your physician either runs a food sensitivity panel or you are engaging in a food elimination diet so you can take a look and see what's going on. Autoimmune gastritis is very, very common with this. The gut is important. The gut's important no matter what organ you're looking to heal. So always take a look at your gut health. Let's see, what else can we do to support the thyroid here? Selenium is beneficial. Making sure you're doing a high quality multivitamin is, of course. Holy basil, bromelain is great. Bromelain's a fantastic anti-inflammatory. So if you're not familiar with that, that can be used for joint pain. It can be used for the thyroid, pretty much anything. So I'm a big fan of bromelain. I use it quite a bit, obviously, in our practice. What else can I tell you about treating it? Don't take minerals within 4 hours of your thyroid medication. And again, if you can eliminate dairy, that's going to be your best decision ever. Make sure you're consistent with your medication or with supplements if you're trying to treat your thyroid with vitamins and minerals. What else did I want to share with you? There's a great cookbook by Susie Cohen, Thyroid Healthy. If anyone's familiar, if anyone's used that, please comment, let me know. But I like that as far as eating for thyroid health. Take a look at chronic infections. So I have a handful of patients right now with a variety of conditions that have chronic infections that were never addressed, or they were assumed to be addressed because the symptoms had been resolved, but they are causing some huge disruptions in cellular function for these patients. So if you have chronic sinusitis or chronic yeast infections, make sure that you take a look at why, again, not just treating the symptoms, so that your body can heal entirely and that you are not utilizing your cellular energy to continually fight. It's very hard. It needs to be treated. Sleep is the cornerstone of healing from these conditions. And again, it goes hand in hand like we talked before. So, you should sleep, but you're having trouble sleeping because the thyroid isn't working, but then you're not sleeping, so it's making the thyroid worse. So incorporate some of those recommendations from the sleep talk that I did and see if you can improve some sleep. Biofeedback is great. If you're not familiar with this technique, I use in our office something called Heart Math. It's fantastic. You can get a little app for the phone, or you can get some separate equipment and do it on the computer. You can play games. But essentially what you're trying to do is control your heart rate through relaxation techniques, through deliberate relaxation techniques. So that's a really great way to do it. To give you some information on the thyroid overall, it's very sensitive to environmental stimuli. So our stress level is going to impact that. That's why I want to talk about it today. So I want to have everyone go ahead and take a deep breath, sit with your feet flat on the floor, scoot back a little bit. Hands can either be open to the sky or flat on your lap, whatever's most comfortable for you. But I want you to go ahead and take a deep breath in for a count of 4. You're going to hold that for a count of 4. You're going to exhale for a count of 4, and you're going to hold that for a count of 4. So go ahead, let's breathe in. You're going to hold that for a count of 4. You're going to exhale, and you're going to hold that for a count of 4. And remember, when you're breathing, the air should be coming into your belly. Belly should be expanding, not the chest. We want to make sure that we're able to decrease our stress hormones with some really great deep belly breathing. So I hope that was a lot of information really fast on the thyroid. I hope that you found it beneficial. A couple last things I wanted to leave you with. I guess we talked about our test. We talked about factors that impact it and help. So if your physician is not willing to do a full thyroid panel, if they're unaware, if they don't want to analyze a full thyroid panel, please remember that your physicians work for you. So it may be a difficult choice, but you need to find a different physician. And testing can be done remotely as well. So if there are things in here that you find that I can be beneficial to, please feel free to send me a message. Obviously, these weeks we've been doing a lot of telemedicine. All of our consultative services are available via functional medicine. So if you have some private questions and you want to delve a little bit deeper, let me know. But you should always be addressing your adrenals first, then your thyroid, and then your sex hormones, because there's no point in continuing to put gas in the tank if your gas tank has a hole in it. So remember, you want to patch things up first before you're medicating symptomatology. So as always, thank you for watching. Love you all. Hope that your Sunday wraps up very well here. I'm not quite sure what we're going to be talking about tomorrow. If you have an idea, if you have questions, please post. I'm open to suggestions. Anything that is impacted by stress or that you can impact your stress by doing, we will incorporate here. So share with your friends. Again, remember, it's okay to not be okay. I think mood changes these days probably by the minute. So I love you all. Stay well. And if you need me, anything privately, again, feel free to message. Or if you want to send a question out to everyone, I'm happy to post it anonymously. Have a great day. Bye-bye.